Almost every single person we talked to said, hey, the biggest issue is paying for meds. So we said, how can we alleviate that pressure and how can we do it effectively?
According to the Center for Disease Control and Prevention, about 2.7 million people in the U.S. report suffering from OUD. One common treatment method is the use of medications for opioid use disorder, better known as MATs.
Medication-assisted therapies is the gold star. It's like the one standard that folks use to treat opioid use disorder. It's more effective, people stay in treatment longer, people are in recovery longer.
However, because of how expensive these medications are, it can become an issue for people to get.
People have providers they can go to get it prescribed, but those folks don't cover the prescriptions themselves.
To help, Forsyth County Behavioral Health Services is planning to use a $3 million portion of their opioid settlement funding to help provide these medications to those in need. The funding comes after the county received a total of $35 million over an 18-year period from that settlement to implement prevention, treatment, and other strategies. Under the plan, a significant portion of the funding will go towards medications for opioid use disorder, but it will also help pay for things like harm reduction services, treatment programs, and opioid overdose reversal drugs, amongst other things.
We find if people are able to afford their meds, they're more likely to stay in treatment, as you can imagine, and more likely to keep a job, more likely to be able to just function day to day.
The county says the goal is to help as many people as possible and to continue reducing the number of people experiencing OUD, as well as decrease overdose deaths. How do you think this is going to impact those people suffering in Forsyth County?
I think the more folks that we can serve through MAT services, the better. So if we know that folks can go to MAT and get the same exact dose every day, we know those folks are safe. If they're buying drugs on the street, they are not.
County commissioners must still approve the plan at their May 4th meeting. If it is approved, the funds could be distributed as early as July. In Forsyth County, I'm Casey Zanowick, ABC 45 News, standing up for you.